Dyson.
My question is to the Minister of Health. Is he comfortable with the numerous announcements of health cuts in the last 20 months?
The Honourable Peter Dunne.
Mr Speaker, on behalf of the Minister of Health, there have been no cuts in the health budget in the last 20 months. In fact, government funding for health services has increased by $1.3 billion in that time, $1 billion of which has gone to district health boards.
The Honourable Ruth Dyson.
Supplementary. Does he think that people waiting in corridors without even a corridor bed at North Shore Emergency Department will agree with him about no health cuts, or will they find his total lack of action to help them rather confusing, given his noisy attacks against health staff at that hospital on this very issue in the winter of 2007?
The Honourable Peter Dunne.
Speaker, on behalf of the Minister, I should point out to the member that funding for that particular district health board has increased by over $100 million in the last couple of years. The issue of how it deploys that funding is a matter for the district health board. Perhaps I could give the member an analogy. This is about reprioritisation in just the same way as the previous government reprioritised $110 million out of the health system just before the last election.
The Honourable Ruth Dyson. Order. Order. Order.
Meant to tell the truth there.
Now, the Minister has to have a reasonable chance to ask a supplementary question. The Honourable Ruth Dyson.
What does he say to the nurses in Taihape at All Taihape Health who have been told to take a 30% pay cut or their hospital in which they work will be closed?
The Honourable Peter Dunne.
Mr Speaker, the advice that I have received is that that matter is currently the subject of negotiations with the Whanganui District Health Board. It is grossly inappropriate for ministers to intervene in what is an industrial relations process, something I thought the party opposite would well understand.
Dr Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health, what recent reports has he seen on improved frontline services?
The Honourable Peter Dunne.
Mr Speaker, on behalf of the Minister of Health, I've seen some reports that indicate a number of improvements over the last 20 months. For instance, we now have shorter emergency department waiting times, a record rise of some 13,000 patients getting additional elective surgery last year, shorter waiting times for cancer treatment, higher levels of fully immunised 2-year-olds, and over 240,000 New Zealanders now getting access to medicines that they weren't getting previously.
The Honourable Ruth Dyson.
What does he say to the good people of Taihape who face losing all their locally delivered frontline health services if their hospital is closed, or will he wash his hands of that responsibility as well?
The Honourable Peter Dunne.
Mr Speaker, on behalf of the Minister, the member is jumping to a number of unwarranted conclusions. There's no suggestion that closure of that hospital is in the pipeline. The reality is that the process has been gone through between the staff of the DHB and their employer. That matter should be left to resolve itself.
Honourable Ruth Dyson.
What, if anything, will he do to support the elderly man who has dementia and Parkinson's, who is being held in Rimataka prison, not because of his risk to the community, but because nobody can find a health-funded home for him to live in?
The Honourable Peter Dunne.
Mr Speaker, if the member cares to take up that case directly with the Minister's office, it will be addressed.
Question number 6, Joe Goodhue.
Thank you, Mr Speaker.